When we opened the inpatient unit, staff decided we'd like to name it Sempervirens for our redwood tree here, of course, and the Latin translation, somewhat loosely, but means all was living. And we felt that that was an important concept in mental health, because let's not forget that we really are always living and that we have something to live for. So that's kind of the way that that started.
Gladys Strope was a major force in the development of the whole concept and implementation of the community mental health system in California.
Community mental health is about partnerships and developing a continuum of care for anyone struggling with mental health issues and allowing them to access the services that they need at the level they need.
We did this survey of the many organizations, as many as there were in the county at the time, about what kind of needs they felt. Do you think we even have a need for mental health services? A few years later, we got a unanimous decision, yes, it was time.
When Sempervirens opened more than 50 years ago, it was Humboldt County's first psychiatric health facility.
When it opened, it was an open facility. We had 12 hospital beds and people hospitalized, but people came in from the community. It wasn't a locked facility at all. It is a very much different facility now than it was. It is very much more acute and just a different population than we initially served.
Sempervirens serves people who are in acute mental health crisis. People can come in voluntarily or on a legal hold, and they have to meet certain criteria.
It is really important that Humboldt County Mental Health has an inpatient facility in county and then can provide all of the follow-up services.
We're the only inpatient unit in the county, and so we allow people to get support and treatment for their mental health crisis while remaining connected to their family and friends and the support systems that they've developed here.
There's great connection here between mental health services Humboldt County Mental Health provides and Sempervirens, which adds to continuity and quality of care, having everything on one site. And Humboldt County is really fortunate to have that. There are very few counties that have what we have here.
I'm just always so humbled and proud of staff, all staff in mental health, but staff on Sempervirens in particular. They do really hard jobs. They engage with people that are in crisis in a way that is kind and respectful and supportive and stabilizing, and they do that expertly.
Maybe the bottom line is that you really do get more than you give. I just have felt so lucky and so joyful, really, that I've been able to make some of the connections I have and been able to do a little bit, even a teeny bit of good stuff, and that's what counts.
Huge thanks to Gladys Strope and all those who worked with her 50 years ago. There was so much passion and vision and commitment to improving mental health in our community, and so the work that was done then has served us to this day and will into the future.